Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities, and it's going to be really an amazing experience, and I look forward to you joining me on the jar. Hello, everybody. Welcome back to Mental Health Today. I'm your host, Ken Stearns. I'm also the founder of the JAR Foundation, and the JAR Foundation is sponsoring both this show and the JAR podcast, which is a traveling show. You just saw a little bit of information on that as I travel around the country, visiting 111 cities, talking to 444 humans about life stuff. And that show led me to really discover the mental health crisis in America today. And I'm sure, as we've talked to people internationally, it's everywhere in the world. It's a real crisis. And we're here trying to do our own little part to kind of discover and give a platform and a voice to people in this space. And it's very interesting, as I've been in here finding a lot of very unique solutions and a lot of really interesting journeys, how people end up in the place and how they end up really passionate about what they're doing and how they ended up in the mental health space. And it's fascinating for me. This is a great beehive that we've put together. We've got a lot of great episodes already on file of super inspiring people. Mark, our next guest, really also fits all of those things I described. We just having a giggle off screen. How many years ago, neither one of us imagined we would be on this kind of a show as potential subject matter experts, let alone a guest. And but yet here we are, Mark. I'm almost going to call myself I'm definitely a subject matter host pert. I'm a host pert. I'm definitely an expert host in this space at the moment. I feel like. Mark, welcome to the show. Thanks for taking the time out. You're at the airport. I mean, that's super conviction. Thanks for being a guest and thanks for taking time.
Sure. Yeah, it's my pleasure. Happy to be here. Thanks for having me.
Yeah. How about I was watching I went to your website and I watched a little bit of your interview with the TV show. I guess it would have been a couple years back. Definitely at least a little bit ago.
Yeah.
Very interesting. And then also just hearing your story. So maybe you could share with the audience a little bit about what were you doing before this and what was that epiphany moment? What was your personal experience that brought you to the space? And then we can talk a little bit about what you're doing in this space.
Yeah. So again, my name is Mark Nolte. I'm the CEO and founder of Start Talking. And we do teletherapy, behavioral therapy. And so my background is for over 30 years, I was in medical devices, selling products used in the operating room. So I was in scrubs every day, working with surgeons, and it was a great career and all that stuff. But back in 2010, and I get this question all the time. It goes, so Mark, are you a therapist? Like, no. Well, then how'd you get involved in this business? Well,
yes.
Back in 2010, I was diagnosed with depression. And I tell people I was one of the lucky ones because I went and got help, and now I live a much happier, productive life. But at the time, the hardest thing for me to do was go park my car in front of the psychiatrist's office, which was near where I lived and worked, and then to go in the lobby and go like this, hoping I didn't run into anybody that I knew or worked with. And that was one of the hardest things for me to do. And at the time, I thought there's got to be a better way to do this than to, show up and have to park your car in front of the therapist's office. And so at the time there was Skype, and I thought, well, maybe you could do it through Skype, but the technology wasn't really that great.
No.
And so I decided, I became a Zoom customer in 2016. So I like to say I was Zoom before Zoom was cool. And I had been talking to therapists for 4.5 years about doing therapy by video.
Oh,
and they're like, Mark, it's just a fad. It'll never take off. I'm not interested. Don't bother me. Well, then March 2020 hit. COVID began. And my phone started ringing off the wall. And all these therapists who said for 4.5 years that they weren't interested. Like, hey, Mark, that teletherapy thing you've been talking to me for 4.5 years? I'm ready to do it now.
Yeah.
Can you have me set up by noon today?
Yeah,
I'm like, really?
from my 1 o'clock.
Yeah, exactly. So we went from doing 27% of our video sessions by video to 97% in 4 months. We quadrupled in 4-month period. So, as I like to say, I was at least at the right place at the right time, because we had been doing it for over 4.5 years. So where other people were scrambling, trying to figure out how to do teletherapy, we had already done it.
You had
And
literally been doing it.
right,
Yeah.
right. And it's interesting now, because a lot of therapists, I'll talk to them. They go, well, what do you think of this, teletherapy? I go, well, I really didn't care for it first, but then I was forced to use it, and now actually I kind of like it and prefer it over doing a therapy session. And I had two therapists that were in the San Francisco area, right down in the financial district. They were paying $5,000 a month for office rental, and back then when COVID started, the state of California said you will not report to your office for a year and a half. We know that. So they ended up canceling their long-term office lease and are now doing totally teletherapy. And, that's $5,000 in their pocket, where before they had to make $5,000 before they even made a profit in their practice.
Oh, plus a receptionist.
Yeah, and a receptionist. And then the other interesting thing is, I have two therapists that live full-time in their RV. And they are licensed in New York and Florida, and they drive up the East Coast, up and down, just doing teletherapy sessions from their RV. And I asked them, I said, well, what's the Wi-Fi reception like? They go, oh, these RV parks have great Wi-Fi, so I just do all my therapy sessions right from my RV or whatever type thing. So it's opened up a lot of things. And the other thing that I didn't even mention is that if you're in a small town or rural area, and let's just say Colorado, and you're lucky enough to have a therapist in that office, the last thing you want to go do is Joe go park his pickup truck in front of that therapist's office on Main Street. And everyone
No.
goes, hey, Joe, we saw your pickup truck in front of, Dr. Smith's office. Are you going crazy or whatever?
Yeah, you all right? What? Yeah, whoa,
Yeah.
what's happening?
Yeah, exactly. So Joe's not going to do that, but Joe
No.
will get on a smartphone in his pickup truck and have a therapy session, and no one knows that he's
Yeah.
having a therapy session. So it takes the stigma out of getting therapy. And that's, sharing my story, I had the same stigma. The hardest thing was actually parking my car and going to the therapist's office. So teletherapy takes that stigma away. And the other thing too is people are more comfortable being in their own home, doing teletherapy than going to some stranger's office and sharing their most inner thoughts, personal thoughts about that. And we did a pilot study on teletherapy versus in-office therapy, and we found out there's a 30% less cancellation rate or no-show rate with teletherapy. And it's very simple. They don't have to no longer drive to downtown Denver or take a bus and pay for parking and hire a babysitter.
Yeah.
If they've got kids, they can just do it from their smartphone or
Yep.
laptop from home and put the kids down for a nap. And it makes it a lot easier and more convenient. And the therapists like it. 30% less cancellation rate, no show rate with online therapy.
I mean, that's significant.
Yes.
I mean, if you're making $210,000 a year as a therapist, holy cow, that's real money.
Yeah. And they like it because they have less of a cancellation rate or no show rate. And not to even mention, they don't have to have a long-term office lease anymore they're paying for. So that's money in their pocket as well. And now it's been proven with white papers that teletherapy is just as effective as in-person therapy. So that kind of took the question mark out of it as well.
I would imagine I've never been to a therapy session in physical, but from what you see in the movies, you sit on a couch or a chair. There's not a lot of body language. I think a lot of the things that you think you'd miss, you don't lose with a video call. I don't think, and there's not that
some
much.
Some therapists will say that, like right now, the way you're looking at me, that I might be tapping my foot or moving my hand or something like
Yes.
that, and they don't pick up that signal. But you know, is that you know percentage wise, how much does that happen or do you miss versus having to do an in-person therapy just to pick
Hmm.
that up?
Right.
It's not that big a deal. And
And from,
and
yeah.
I'll be honest with you, not every patient's a candidate for teletherapy. If they have severe mental health issues where they're bipolar and schizophrenic, they probably need to be seen in person. But you take 80% of the population who either has mild to moderate depression or anxiety, they're a perfect candidate for teletherapy.
Yeah, agree. Totally. I totally understand that. There's definitely, it's obviously not going to solve, not going to be a fit for everybody.
Right.
The reality though, on the flip side of that, if the numbers I've looked at, I've done some light scratching, and although I'm not super confident of it, because it's data, but the number of therapists per 100,000 of what the number that we're supposed to have, number of therapists per 100,000 people, the number that we have is so far below the number that we think we need.
Right.
Um, I think it's something like we have less than half. I can confidently say we have less than half the therapists we should have.
Right.
And that's nationally. So, San Francisco, New York, Chicago, they're probably at 80%, or maybe even some zip codes 110%.
Right.
But you get Missouri, I bet Missouri's 50%. Lucky.
Yeah, as I mentioned earlier, I used to live in Kansas City, and if you go out to western Kansas, there won't be one therapist for entire 6 counties out there.
Yeah.
So
How does that
what is
work?
a patient going to do out there in those 6 counties that have no therapist? Well, teletherapy, and they can have access to a great therapist that lives in Kansas City and not have to drive 5 or 6 hours to see that therapist.
It's not, it's even even if we did a national program tomorrow where we fast tracked 1 million people, it's not sustainable. So the solution of more therapists is not the answer. It's not, even that is not sustainable. We need this other solutions like what you're doing.
Oh well, we hope the genie's out of the bottle now. We may go back to a hybrid system where there might be some therapies, some in an office and some by video. Um, and we are seeing a little bit more demand for, um, in-office therapy. But really, what happens is the patient will come in for the first time and see the therapist in the office, and they go, "Okay, yeah, I've kind of vetted you, or I like you. Okay, let's do the rest of the sessions by teletherapy." So they might do the first one by in person, but the rest of them they want to do. And I had to talk to these therapists before they were convinced. I said, listen, I said, I'm a baby boomer. And usually if they're a baby boomer, I said, it's not going to be our generation that adopts this, but the millennials and the Gen X and all that stuff and Z or whatever, um, they're the ones that are going to adopt this. And if you don't do this by video, they're going to find another therapist who will. And
Abs-
so you may see
Absolutely.
your practice starting to deteriorate or not getting as referrals because you don't offer teletherapy.
Your clients will become narrower and narrower and narrower. Yeah, you'll see older and older and older patients, less and less and less.
Right.
Yeah. Yeah. You're not going to grow your business. And
No.
why would you not want to? For me, couldn't imagine as a therapist, what a great way to do your job.
Yeah, because if they're at home and they have a cancellation, they can do something at home or, take care of the kids. Or if they're in office, they're pretty much stuck there. And
Yeah.
they can't do anything but wait for the next patient or whatever type thing.
Yeah. It's interesting. How long? So you started in 2000, and how long did it take you to
Actually,
get the business together?
I started it in Kansas City about 2013, and
Okay. So by the time you got it started, it was 2013.
yeah, and I
Okay.
got some traction there in Kansas City, and back in April of 2017, I decided to move to Denver, Colorado. So you've heard the expression "move west, young man, move west." I
Yes.
told myself at age 60, "Move west, old man, move west."
Yeah, move
So
west, you.
yeah, so because I found the startup community more cutting edge here and more progressive, and we just got a lot more traction. And I started here with 8 therapists locally here in Colorado back in October of 2017. And then we've grown now in the last 6 years. We've got over 230 therapists in 33 different states.
Jeez.
So, yeah, and we'll be eventually in all 50 states.
What's the biggest challenge?
Um, you know, the biggest challenge is um, therapists are great at what they're trained to be, and that's to be therapists.
Mm.
But because they're not trained to be very good business people, they're not the greatest business people. And because of that, they're even the worst marketers of their practice. So convincing them that they need our services and,
Oh,
need to pay for it, they're like, well, no, I don't have to do that type thing. And, um, then they realize they do, because it takes a therapist 2 to 5 years to build a full practice. Well, their idea of marketing themselves is to put their business card up on a bulletin board at the local church, to get therapy sessions.
I'm
And
marketing.
yeah, and it just doesn't hack it. And so, and they also have a phobia, if you will, of coming across what they call salesy. They don't want to be,
They have their own phobias.
yeah, that they come across too much as a
Right.
salesperson. And really, you just need to tell them about the benefits of of therapy, and you don't have to come across salesy, but they're really have a really concern about having that. So that's where we come in. We have their profile and picture listed on the website and do all the marketing stuff. And frankly, they prefer it that way because they don't have to bother with that part of the business. And even if they were good at it, they don't have the time to market their practice. And that's where Start Talking comes in. We can have their whole profile on the website. And then we also on the website have a booking widget where you can actually click on there to go straight to the therapist calendar, and you can book an appointment right with a therapist right there without having to play phone tag going back and forth trying to figure out a time to meet. And then you meet by Zoom. So it's
Yeah, these I'm in Calendry or Calendry, or I don't even know how to say the name of the app, the
yeah,
scheduling app, and those things are magic. I I mean, you used to ding dong with people trying to find a time to meet with somebody, and now if somebody sends you a calendar, or you send yours, and you look it up, and boom, 2 minutes later you're done.
yeah. And
So
I
these
include
booking things, oof,
yeah,
good.
I've got the same service through HubSpot, my calendar on there, and so on the email, so that they can schedule a time with me versus playing phone tag or email tag trying to schedule a time. You know, can you meet Thursday at 4 o'clock? No, but I could do Friday. That stuff going back and forth.
Right. What do you what do you see? What happens next? I mean, if this is, are we at this revolution? Are we at this kind of new innovative space for a while? Is there anything after this?
Oh yeah,
What do you see developing now?
well, um, I think AI is going to play a big part in it, and let me kind of explain why. So right now, Stanford's already done this. Um, so if you're a person that has PTSD, they can tell by your they've done 10,000 videos where they can tell um, by your if you're told a joke and you smile less than the average person, that is a sign
Mm,
through your facial expressions that you have PTSD, and they've been able to
wow.
diagnose that.
Wow.
So yeah, so I think they'll use um, video and facial expressions to recognize,
Huh.
whether people have or they're doing it now with PTSD. And the other thing is, we're going to use AI to probably diagnose people before it's over with, because there's tag tag words like, depression, having trouble sleeping, don't feel like doing those kind of things, to the point that the AI may be able to do a better job of diagnosing you with depression or anxiety because of machine learning. And, now a therapist may have to meet with you for 2 or 3 times before they actually find out you may
Right.
have
To
depression
make
or you
the,
may
to
have
make a
anxiety.
diagnosis, right?
Yeah. If you can do a 20-minute video and ask some questions, and through AI, you can be diagnosed as having, an 80% chance of having depression or a 90% of having anxiety. That is huge for the therapist, because now they can start right from the get-go and say, okay, I see that you have an 80% chance of depression, so let's explore that or talk about that. Or you may miss something as a therapist and say, well, this person has depression when they also have anxiety, but you didn't pick that up. But AI would do that.
Yeah, it's hard. It's hard to fathom all the places AI's. Maybe it's probably better to say it's kind of hard to imagine what AI won't touch.
Yeah.
Um, but this part, the idea that AI could diagnose you. I mean, imagine if I don't know how many. Do you know how many licensed therapists are in America? Any idea what the number
I
is?
think there's like something around a 500,000 last time I looked.
Okay, yeah. So you got a half a million individuals using a half a million completely distinct finally, like, because it's ultimately applied by the individual. So 500,000 unique ways
Right.
to define depression. And now you can have an AI,
Right.
and maybe it's 4 versions of different competing products. But imagine that it's going to mean something like depression will mean it's these 7 things and answered in this way. And wow, that's
Yeah.
pretty good. That's like a proper blood test.
Yeah, and it could be that, if nothing else, it verifies what they thought all along. In other
I,
words, yes, you thought this patient was depression, and per the AI, we think this person has an 80% chance of being depressed. So
yeah.
it'll just help verify. And again, if they missed anything, it'll help do that. And eventually, with machine learning, it may pick up things about, for instance, depression that you would not even think about as a therapist. That's some obscure thing that it's going to learn, that's going to be
Mm.
helpful in diagnosing the patient.
What I mean, to get crazy talk. I mean, just since we're on Start Talking, and we got .io, which is definitely a blockchain slash Web3 kind of a geeky address. Um,
Yeah.
I mean, why not have Alexa be integrated with everything? The future Alexa, your assistant, your AI, because we'll all have AI assistants running around in some way, shape, or form, right around the room. We got vacuum cleaners, and that's the beginning of having something in a moving one, and then we got static. I mean, why not have wake up and get those 10 questions in the morning, or Alexa
Yeah.
will be able to, I think, at some point say, are you feeling a little different today? I've noticed that you didn't exercise, you didn't get your coffee, blah
Right.
blah blah. How are you okay today?
Well, the other thing you could do is, like, so let's use the example that, you did the first AI thing test where it says
Yeah.
80% of depression.
Hmm.
As you go on with your therapy sessions and the AI asks you those 10 questions or whatever type thing, it can figure out that, oh, now you're only 50% depression, or you're only 30% depression. So
Yes.
in other words, it's showing improvement. It's got a quantitative, scientific uh, numbers to go with it,
I
versus
think
just kind of being subjective interpretation.
yeah. I mean, kind of interesting. That's scalable.
Yeah.
That is scalable. But having 2 million therapists probably a lot harder,
Yeah.
and
And
harder
therapists
to.
are this is not a dig at them, but they're reluctant to adopt new technology because they were trained in a certain way in school, and
Yeah, but
they're not really innovators per se. And it was
I'm the
interesting because before COVID, they were predicting that teletherapy would not surpass in-office visits till 2024. And
That's pretty
fortunately,
good. That's pretty good, though. That's impressive. I would have thought 2034.
yeah. Well, the interesting thing is, if that hadn't happened, I might have gone bankrupt
You would
because
have gone
people
back. Yeah.
go,
Yeah.
Mark, how's your new startup going? I go, well, the good news is I'm early to the market. The bad news, I may go bankrupt before it all
Before the
matures.
market gets here.
Yeah. So, I hate to say this, but COVID was good for a business and it accelerated the teletherapy adoption by 4 years earlier than what they're predicting back 10 years ago.
I don't think you'd end up at this. I honestly, I think 2024 would have been hard. I don't know
Yeah.
how. I don't, and it might have been past it by a bit, but it's gone way past that,
Right.
and it's never going back. Can't put the genie
No,
back in the
the
bottle.
genie's out of the bottle. There's too many people that are committed to it now. And to me, therapists have canceled their long-term office lease and working from home.
Yeah, I've interviewed several therapists here who have said, "Oh, I had an office, full blown office. We've closed the office.
Yep.
I put addition on my house. It's where I have the main business for in the office, and we do paperwork here. But all therapists are at home. No one goes to the office.
Yep.
There's no
Exactly.
office. They totally. So these are younger therapists.
Yes.
They're 30, they're 30ish, and the
Uh-huh.
whole business has gone online. Yeah, they embraced it immediately.
Yeah.
Um, so it'll be interesting to see how AI does play a role, and I think definitely we're on the cusp of that to see how quickly that stuff will happen. I mean, there's a lot of money in it, and there's a lot of resources looking at solving the crisis. So those are two things that do lead to innovation and fast change. Problem to
Right.
solve, money, and smart people. And
Yep.
there's a lot of passion in the space. A lot of people personally affected, like yourself, who take it personally, and they've got a passion to fix it.
Yep.
What a journey you've been on! Very interesting.
Well, thank you. It's been a lot of fun and sometimes scary and sometimes very exciting, but it was fun to be a part of the whole process. And not to pat myself on the back, but I take great pride in the fact that I was early to the market and
Yeah,
saw the
you
innovation coming.
should be. It's interesting. You did it from a consumer. You were solving a consumer problem.
Right.
You were solving a consumer problem.
And there were a
Um,
lot smarter people than me that were in the business
I
saying, "Oh, this will
it's
never work." So I'm thinking, well, why am I the outsider,
I,
the device medical sales guy, thinking that this is the way it's going to be? So,
yeah,
but
at some point you must have been laying there going, "Am I the idiot?"
yeah, yeah, exactly. That's what you
Like,
think because there's a lot of smart people with a lot more
right?
initials behind their name
Yes,
that are saying this
exactly.
is not going to work or there's issues with it. And they've been doing this a lot longer than I have. So what makes me think that I know, what's
Right.
going to happen?
I'll move to Colorado. That'll fix it.
Yeah, there you go.
There must have been some shit panic nights writing salary checks and writing checks
Yeah,
for the algorithms and all the people and seeing the money's like not happening and
yeah.
whew,
Well, and just the frustration of trying to convince therapists to do this.
yeah.
It was, like I said, it took 4.5 years, and uh, fortunately or unfortunately, COVID hit, and it made the adoption much quicker. But I'm not sure I could have gone another 4 years past that
No, you
before it
would have
got
made it.
adopted.
Yeah, no,
Yeah,
you wouldn't. I mean, there's not many unless you just got a couple of good therapists. You just need, and you need one. You need one big clinic is what you need, and a couple
yeah,
clinics to fall into the lap and start offering it.
yeah.
How about some closing thoughts? It's been kind of a fascinating conversation. I like how fact we're totally aligned on everything, Mark. We're kind of in the same space. How about some? What do you think about some closing thoughts for the audience,
Well,
or a message you'd want to leave?
one of the things I'm a member of the Stability Network, and you can look it up. It's just the stabilitynetwork.org, I think. But anyway, we're all professionals who have or have lived with a mental health issue. And um, uh, when I make speeches or whatever, my big thing is to get men to get therapy. So, in other words,
Hmm.
if you look at the highest suicide rate right now, it's late teenagers, early 20s. The second highest suicide rate in the country are men over 50.
Yep.
And the reason is a lot of these men were ex-military veterans, first responders, firefighters, policemen, who have put all this trauma, as I say, in the closet and shut the door on it.
Yes.
And about age 50, they open that door, and all that mental trauma or PTSD comes out. So my sermon to everybody is that, I understand you were a battle-hardened veteran, but this is a different thing. I don't care how tough you are. If you got your shoulder injured, you wouldn't think twice about getting physical therapy for your shoulder. So why not get therapy for your brain to help that as well?
I agree.
And it doesn't mean you're less of a man or less macho or less tough, because you look at some of these NFL linemen who took their life by suicide, and those guys are tougher than nails. You're not going to get any meaner or tougher, and yet they couldn't deal with it. And I know with my own experience with depression, I never got to the point of thinking about taking my own life, but I could see that if I didn't do something, it was going to be a spiral, plane going down. And that's what some of these people get into, and especially men in their 50s. They get in that spiral, and you can't take yourself out of that spiral. And that's when they ended up taking their life by suicide. So I guess to end everything, just say, go out there. Don't be shy or think you're less of a man.
Yes.
By getting therapy. You need to go out there and get it and take care of yourself and prove yourself so that your family and loved ones can enjoy you for a long time.
Yeah, and I think I couldn't agree more. And I think playing that role of just showing people, right? I was brave in battle. I was a first responder at home. Yep. And now I'm going to fix myself. I'm going to go take care of myself, Yep. Get some, clean out some of that junk out. I need help. We all need help cleaning out our closet sometimes, yep. Right? I mean, it's not a job you want to do by yourself.
Yeah.
And so why not invite a friend into your home and have a chat with somebody and get the job done?
Exactly.
Mark, hang around. I'm going to throw a commercial up, and then I'll see you on the other side real brief.
All right. Sounds good.
Thank you, everybody, for listening and supporting the Mental Health Today podcast. You can find us on all the normal channels, as well as this show will be posted up somewhere on Facebook, LinkedIn, and YouTube. See you tomorrow.
Yeah, loose, baby.
But we're about to go and make this vessel with these great professionals in public glass. We're not part of the community, but we're from the outer family of glass blowing. Yeah, we're going to go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.